Diabetes is a disease caused by high levels of blood sugar, glucose, in your body. This can happen when your body does not make insulin or does not use insulin correctly. Insulin is a hormone made in the pancreas, an organ near your stomach. Insulin helps the glucose from food get into your body's cells for energy. If your body does not make enough insulin, or your body does not use the insulin correctly, the glucose stays and builds up in your blood. Over time, this extra glucose can lead to prediabetes or diabetes. Diabetes puts you at risk for other serious and life-threatening health problems, such as heart disease, stroke, blindness, and kidney damage. Type 1 diabetes is an autoimmune disease, meaning the body's immune defense system attacks and destroys the cells in the pancreas that make insulin. If you have type 1 diabetes, your body does not make insulin, so you must take insulin every day. Type 2 diabetes. This is the most common type of diabetes. You can get type 2 diabetes at any age, even during childhood. With type 2 diabetes, your body does not make enough insulin or is not able to use its own insulin correctly. When this happens, blood glucose levels rise. Gestational diabetes. Gestational diabetes is a type of diabetes that happens only during pregnancy. Gestational diabetes can cause health problems for the baby and the mother if not controlled. Although gestational diabetes goes away after your baby is born, having diabetes during pregnancy raises your risk for type 2 diabetes later on. To learn more about gestational diabetes at the National Diabetes Information Clearinghouse. A risk factor is something that puts you at a higher risk for a disease compared to the average person. Risk factors for type 1 diabetes in women and girls include family health history, having a parent or brother or sister with type 1 diabetes, certain viral infections or illnesses, such as Coxsackie virus, be a common cause of hand, foot, and mouth disease, rotavirus, also called stomach flu, and mumps 3, where you live. It is more common in people who live in colder climates. Risk factors for type 2 diabetes in women and girls include, for overweight or obesity, body mass of 25 or higher for adults. Find out your BMI. Children and teens weighing above the 85th percentile based on their BMI are at risk for type 2 diabetes. Find BMI charts for children and teens. Older age, 45 or older. After menopause, women are at higher risk for weight gain, especially more weight around the waist, which raises the risk for type 2 diabetes. Family health history. Having a mother, father, brother, or sister with diabetes. Race, ethnicity, family background of African American, American Indian, Alaska Native, Hispanic, Asian American, and Native Hawaiian. Pacific Islander having a baby that weighed 9 pounds or more at birth. Having diabetes during pregnancy. High blood pressure. Taking medicine for high blood pressure or having a blood pressure of 140/90 mmHg or higher. Both numbers are important. If one or both numbers are usually high, you have high blood pressure. High cholesterol. Lack of physical activity. Women who are active less than 3 times a week, having polycystic ovary syndrome. Personal history of heart disease or stroke. If you have any of these risk factors, talk to your doctor about ways to lower your risk for diabetes. You can also take the diabetes risk test and talk about the results with your doctor. Diabetes usually develops in children and young adults, but it can happen at any age. 5. It is more common in non-Hispanic whites and non-Hispanic blacks than in Hispanic populations. 6. About 5% of people with diabetes have type 1 diabetes. 1. If you have a parent or sibling with the disease, you may be more likely to develop type 1 diabetes. Type 2 diabetes is more common in adults, especially in people who are 45 and older, have a family history of diabetes, or have overweight or obesity. About 90 to 95% of people with diabetes have type 2 diabetes. Type 2 diabetes is becoming more common in children and teens, which may be because more of them have overweight, and obesity. Diabetes affects women and men in almost equal numbers. However, diabetes affects women differently than men, compared with men with diabetes. Women with diabetes have the longer you have type 2 diabetes. the higher your risk for developing serious medical problems from diabetes. Also, if you smoke and have diabetes, you are even more likely to develop serious medical problems from diabetes, compared with people who have diabetes and do not smoke. 14. The extra glucose in the blood that leads to diabetes can damage your nerves and blood vessels. Nerve damage from diabetes can lead to pain or a permanent loss of feeling in your hands, feet, and other parts of your body. 15. Blood vessel damage from diabetes can also lead to heart disease, stroke, blindness, kidney failure, leg or foot amputation. Hearing loss. Women with diabetes are also at higher risk for problems getting pregnant, problems during pregnancy, including possible health problems for you and your baby. Repeated urinary and vaginal infections. What causes diabetes? Researchers do not know the exact causes of type 1 and type 2 diabetes. Researchers do know that inheriting certain genes from your family can raise your risk for developing diabetes. Obesity is also a major risk factor for type 2 diabetes. Smoking can also cause type 2 diabetes. And the more you smoke, the higher your risk for type 2 diabetes and other serious health problems if you already have diabetes. 16. Weight loss can help control type 2 diabetes so that you are healthier. Quitting smoking can also help you control your blood sugar levels. Being a healthy weight and not smoking can help all women be healthier, but obesity and smoking do not always cause diabetes. Some women who are overweight or obese or smoke never develop diabetes. Also, women who are a normal weight or only slightly overweight can develop diabetes if they have other risk factors, such as a family history of diabetes. What are the signs and symptoms of diabetes? Type 1 diabetes symptoms are usually more severe and may develop suddenly. Type 2 diabetes may not cause any signs or symptoms at first. Symptoms can develop slowly over time. You may not notice them right away. Common signs and symptoms of type 1 and type 2 diabetes include feeling more tired than usual, extreme more than usual blurry vision, feeling hungrier than usual, losing weight without trying, sores that are slow to heal, dry, itchy skin, tingling in the hands or feet, more infections, such as urinary tract infections and vaginal yeast infections, than usual. What is pre-diabetes? Means your blood sugar glucose level is higher than normal, but it is lower than the diabetes range. It also means you are at higher risk of getting type 2 diabetes and heart disease. As many as 27 million American women have prediabetes. 17. If you have prediabetes, you can make healthy changes, such as doing some type of physical activity on most days, to lower your risk of getting diabetes and return to normal blood sugar levels. Losing 7% of your body weight, or 14 pounds, if you weigh 200 pounds, can lower your risk for type 2 diabetes by more than half. If you have prediabetes, get your blood glucose checked every year by a doctor or nurses. There are anything I can do to prevent type 2 diabetes. Many studies, including the large diabetes prevention program study, have proven that you can prevent diabetes by losing weight. Weight loss through healthy eating and more physical activity improves the way your body uses insulin and glucose. Weight loss. Obesity is a leading risk factor for diabetes. Calculate your BMI to see whether you're at a healthy weight. If you're overweight or obese, start making small changes to your eating habits and get more physical activity. Even a small amount of weight loss, 7%, or about 14 pounds for a 200-pound woman, can delay or even prevent type 2 diabetes. Eating healthy. Choose vegetables, whole grains, such as whole wheat or rye bread, whole grain cereal, or brown rice, beans, and fruit. Read food labels to help you choose foods low in saturated fat, trans